got to go back for a couple of reasons. One is the only countries that we're looking at here are countries that have national health insurance systems. For that reason, I don't have the United States here. The United States is more expensive, but it's not saying I'm going to provide universal access, you know, socialized medicine. They have a very different kind of system. But all of these other countries have the same kind of objective as Canada does, and the objective which is expressed in the blue ribbon panel. Now, I want to draw your attention to the United Kingdom, which is way down here at less than 8%, a very cheap, cheaply run system. In fact, they're spending about the same amount as you are currently in the Bahamas spending. But what's the difference between the United Kingdom and the Bahamas? Is that you are very young and they're very old. So when they're spending that amount, they are, you know, they're contending with a very much bigger healthcare problem than you've got here in the Bahamas because of the age of the population. So just remember that when we go forward here, that United Kingdom they're spending a lot less on healthcare than all these other countries that we're interested in. Now let's go back and look at Canadian results. We're the most expensive. Are we getting what we pay for? Well, let's look at waiting times. These are the waiting times that you can expect across Canada. And one of the first things you notice about this, what is the first thing that you notice about this chart? These are the different provinces of Canada. Anybody tell me what the first thing you notice about it? Just looking at the length of those lines? That they're different. We don't have the same access in Vancouver as they have in Ontario. We don't have the same access in Prince Edward Island that we have. We have a lot of different kinds of access, right? So that should tell you right away that whatever you think and whatever they promise, you are not, ladies and gentlemen, going to get universal, same access right across all of the islands of the Bahamas. You're not going to get it. We've been trying for nearly 40 years to do it, and this is the result. You have big differences in the access to care across the provinces. Now, this is the kind of things that people are waiting for. The Department of Health in Canada a couple of weeks ago issued a special bulletin when we released our waiting list things for plastic surgery. The report was by the Department of Health that there had been an outbreak of ugliness. No, not at all. Of course, this is not cosmetic surgery. This is for people who have cancer of the face or have things where they have to have reconstructive surgery done, and these are the kinds of waiting times that they're experiencing. So you should take a good look. You would have thought that the Blue Ribbon panel would have given some attention to this, and the fact that we've had a huge national debate in Canada about waiting lists, and that every province has now got a special program to deal with waiting times, and that the government of Canada has got a plan to deal with waiting times. And of course, it's all a plan, but these are the results. And what has happened since 1993 when we first got this survey that we're doing now? And by the way, this comes from surveying a very significant fraction, up to 50% of all of the practitioners, specialist practitioners in the country. This is not I wonder what the waiting times are. We're actually measuring the waiting times by the people who in Canada keep the waiting list, namely the specialists. And we've been doing it for a long time. And you can see the red bars, we're not doing well in terms of getting this under control. These are the increases that have happened since 1993 in the length of the waiting time. This is the gap between the reasonable waiting time and the actual waiting time. Reasonable, what does reasonable mean? We ask the physicians to tell us what is the time that is clinically reasonable. That is to say that waiting will not impair the health of the patient. Because there is, you can wait. You know, if you've got a thingamajig on your whatchamacallit, you can wait for some period of time, right? You don't have to get it done tomorrow. But if you got to wait for 5 months or a year and a half, your health care condition deteriorates. In fact, in some cases, if you wait more than a couple of weeks, your health care, if you're talking about chemotherapy for cancer, if you're talking about radiation therapy, or if you're talking, there are a lot of things. You're talking about surgery for it. So when we average that out, what we're discovering is that there's this big gap between the reasonable amount of time that people should wait and the amount of time that they're actually waiting across all surgical groups. Well, we also measure the waiting time for diagnostic technology, and this includes MRIs, CT scans, ultrasounds, and so on. And these have been starting to come down. And why do you think that? Can anybody hazard a guess why these have been starting to come down? Well, because of the advent of private clinics that are offering MRIs and are now, the government is now having to ignore them. For a while, they tried to stamp them out, wouldn't give them licenses, the most incredible array of things to stop people from delivering healthcare services to people. Huh? What? No, but that's what they were doing. Now they've stopped that because, the Supreme Court has made it a little more hazardous for them. If they're now stopping it, now they can be taken into court and be said to be injuring the health of Canadians. So they've stopped that, and so these things are starting to drop. Well, that's just another way of measuring the same thing. Now this is talking about the United Kingdom in the report. There's a lot of references to what's going on in the United Kingdom. The kind of references that are to Canada are the references produced by Ms. Woolhandler at Harvard, same school but different people, suggesting that the administrative costs of the Canadian system are very low. But no mention about any of this inconvenient truth, to use a inconvenient truth about what's going on with regard to our healthcare system. Well, okay, now let's look at, so that's waiting times. Now let's look at access to doctors and technology. And I'm going to go through these quickly because, as I pointed out, I'm way behind. Canada, 24th in the OECD with regard to access to doctors. 13th with regard to access to MRI machines. 17th with regard to CAT scanners. You'll notice up here I've got Japan up here because they would be way off the chart. 78.4 per million population. There's one in every corner store in Japan, as a matter of fact. This is the truth of CT scanners. But they have a very relatively cheap healthcare system nonetheless. But 17th for Canada. Mammograms in the OECD. 7th. Lithotripters, 18th. So in other words, from the point of view of access, we're 24th of 28 countries for access to physicians, 13th of 24 for access to MRI machines, 17 of 23 countries for access to CT scanners, 7 of 17 countries for mammograms, and 18 of 20 countries for access to the lithotripters. It's absolutely clear that Canada is the country that they should have selected, right? Isn't it? I mean, it's unbelievable. Now let's look at healthcare outcomes, because this is where, as they say, the rubber hits the road. Life expectancy and full health in the OECD. Now, you would have expected that the most expensive healthcare system would have produced some higher numbers. But here we are, 16th. And by the way, these are not our numbers. These are the OECD. The OECD does these careful measurements. We have close and ongoing cooperation with the OECD, but they produce these numbers themselves. And you can see that not great. Infant mortality, we're 21st in the OECD. Perinatal mortality, we're 14th in the OECD. Mortality from disease. Now you might think, well, what else do you die from? Well, you die from, jumping off buildings. You die from automobile accidents. In fact, most of our young people die from automobile accidents, and but we're 8th in mortality from disease. Wouldn't you expect us to be up here number 1? I mean, we're paying more than anybody else. Potential years of life lost. This is years of life which are preventable, which we lose and we shouldn't be losing. This is years of life which could be saved if we had